So good day everyone. Our topic this week is about medication. And as a nurse, medication administration is one of the most basic yet an important nursing responsibility. Safe medication administration requires knowledge of nurses about the medication concepts, about the different terminologies that we use whenever we're giving medication, and of course, the different nursing responsibility when giving medication. And we're going to discuss that in this session. In particular, these are our learning objectives. Number one, what are the factors that affect medication? Types of medication orders, how to convert units of weight and measure, how to calculate dosages, administering medication through various routes, and what are the 10 rights of medication administration. So what is medication? Medication is a substance given to a patient or administered for the diagnosis, cure, treatment, or relief of a symptom or for prevention of disease. And the word medication is used interchangeably with the use drug. So when you hear medication and when you hear drug, they are the same. And medications are normally prescribed by the physician or a doctor in a form of prescription. That's why prescription are written directions for the preparation and administration of a drug. When you go to the hospital, medications given to a patient are prescribed by doctors or physicians. Now, medications have a lot of names, and this is one of the most important challenges among nurses because you have to deal with several medications in the hospital. However, there are two important names that you need to remember if you are giving medication: the trade name and the generic name. The trade name is the name selected by the manufacturer, while the generic name is derived from chemical name. I want you to look at the photo in front of you. This is a common medication called Panadol. Panadol is an example of paracetamol and is usually given as a pain reliever. The name or the trade name is Panadol and the generic name is paracetamol. So when you go to the hospital and you encounter a lot of medications, you expect at least two names: trade name and generic name. When giving medication, it is very important for a nurse to know that there are different drug preparation. Drugs could be in a form of tablet. This is a powder drug compressed into a small disc, and this is very common even in your household. Capsules is also common. It is a gelatinous containers to hold the drug. And I know that you have seen this one already in your house. Syrup is very common among children, and it is an aqueous solution of sugar, often to disguise unpleasant taste. Normally, it has added flavors because children dislike medication. Suspension is very common. One or more drugs finely divided in a liquid. If you have seen a medication at home and your parents would add some little amount of water on it and shake it, it is a suspension. Medication could also come in a form of patch. A patch that contains drug to be absorbed in the skin. It is applied or it is placed over the skin. Since our skin has a lot of blood vessels, the medication in the patch will be absorbed through your skin and it will take an effect to the patient. Cream is also common, non-greasy semi-solid preparation to use in the skin. And finally, powder. It is a finely ground drug used internally or externally. When safely giving medication to a patient, it is also essential that you understand the different effects of the medication or the drugs to our body. And one of the most common effects of a drug to our system is therapeutic effect, or these are expected or predictable effect. When we say therapeutic effect, this is the primary effect intended. This is the reason why we give this medication. For example, if we give pain medication, we are expecting that the pain of the patient would be decreased. Or if we are giving antihypertensive drug, we know that the therapeutic effect of this drug is to lower blood pressure. We also have these side effects. Okay, this is one of the most common effects of a drug. These are predictable and often unavoidable. And normally, side effects could either be harmless or potentially harmful. And the worst form of side effects, or more severe side effects, are called adverse effects. If side effects are predictable and avoidable, the adverse effects is undesirable. Undesirable means we do not want this effect to our patient. Unintended and often unpredictable severe response. That's why as a nurse, it is very important to monitor for any adverse effects. And normally, if the patients develop the worst form of side effects or adverse effects, the medication is normally withheld. There are also other effects of drug to our system. And the other form of effects of the drug to our system is called drug allergy. It is also called as immunologic reaction to the drug. And normally, drug allergy occurred if the client is first exposed or is given for the first time a certain medication. Okay? Now, if drug allergy is immunologic reaction to the drug, the worst form or the severe form of allergy which you nurses should monitor is anaphylactic reaction. Anaphylactic reaction, it is a severe allergic reaction to the drug, and anaphylactic reaction is normally fatal. Fatal means it can even cause death to your patient. That's why as a nurse, you need to monitor for any signs of severe allergic reaction to a drug. We also have toxic effects. And toxic effects are deleterious effects that results from drug overdose. Drug overdose means you have given to a patient a medication more than what is required. So for example, if the order is 500 milligram, one tablet, and then your patients took 5, 6, 7, 8, 9, 10 tablets, and it causes deleterious effects. It causes fatal effects to your patients. We call it as toxic effects. We also have iatrogenic disease. Okay? And iatrogenic disease are diseases caused unintentionally due to drug therapy. If your patient is receiving medications or drugs for a long period of time, she might develop other diseases because of the medication itself. I'll give you an example. Okay, normally if the patient is taking medication for a long period of time, the patient might develop eventually liver problems or liver toxicity. And normally, liver toxicity is a form of iatrogenic problem due to long-term taking of medication. Let us further explain or discuss therapeutic effects. As mentioned earlier, therapeutic effects is the desired effect, and this is the reason why the drug is prescribed. These are expected and these are predictable. Now, what are the different therapeutic effects that we expect from our patient? One of the most common therapeutic effects is palliative. From the word itself, palliate. Okay? When we say palliate, to reduce pain or to reduce pain experience of our patient. And normally, when you give morphine, sulfate, and aspirin to the patient, these are drugs. It causes reduction or relief of pain. And that effect is called palliative effect. Okay. There are also other effects such as curative. From the word itself, cure. Cure. Okay? To cure a certain illness or cure a certain disease. I'll give an example. Penicillin is antibiotic. Antibiotic, it is given if a patient has infection. And when you give antibiotic to your patient, such as penicillin, it kills the microorganisms. Therefore, it cures the illness or infection of your patient. Another example of therapeutic effects is supportive. Support, from the word itself, support. I'll give you an example. Aspirin for fever. Okay? It reduces body temperature. We also have epinephrine for low blood pressure. Okay? And you give epinephrine in order to increase the blood pressure of your patient. It has supportive effects to your body. We also have substitutive effects as a therapeutic effect. From the word itself, substitute. When we say substitute, when something is missing or something is lost, we can replace it. For example, insulin for diabetes. I know that you are familiar with diabetes. If a patient is a diabetes, more likely there is a problem with the insulin. It could be very low in our body. And in order to replenish the insulin in our body, we give insulin to the patient as a substitute. Okay? We also have thyroxine for hypothyroidism. Hypothyroidism, if you have problems with thyroid. And normally for hypothyroidism, there is a reduced or decreased secretion of hormone called thyroxine. And normally, thyroxine is given to your patient to substitute, to replace, okay, thyroxine in our body. Another example of therapeutic effects is chemotherapeutic effects. And this is common for cancer patients. From the word itself, chemo. If your patient is a cancer, she will receive certain medications, okay, that will kill the cancer cells. And we call it as chemotherapeutic effect. One good example is pulsulfan. Another example of therapeutic effects is restorative. From the word itself, restore. Restore means to replenish back again. Okay? If you have low vitamins and minerals in your body, maybe because you're not taking vitamins and minerals, or you're not eating food which are rich in vitamins and minerals, okay, in order to restore back the normal amount of vitamins and minerals in your body, you are normally given vitamins and minerals. And the therapeutic effects of those vitamins and minerals are restorative effect. Now, when giving medication, I know that you have a few questions in your mind. Like, for example, Mr., when do we expect a response, okay, to a medication once I give it to the patient? Or questions like, how long will this medication take its effect in our body? Or when do we expect that the medication's action will subside? Now, for you to be able to understand those things, I want you to look at the slides in front of you. Now, the first term that I want you to remember is the onset of action, or time when the body initially responds to a drug. So, for example, if your patient is taking Panadol, and Panadol is a pain reliever, it is given to a patient to reduce pain. Okay, when the medication starts to exert, or the medication starts to cause reduction in effect, initially, we call it as onset of action. Okay? And normally, it takes its effect after a few minutes after you give the medication. Now, we also have this peak plasma level. Okay? This is a time at which a medication reaches its highest effective concentration in the blood. Now, peak plasma level is very important for us nurses. Why? Normally, side effects of a medication occurs during the peak of the medication in our blood. For example, if your patient is receiving insulin, when the insulin takes its peak, you expect or monitor any side effects from the patient. Now, we also have this plateau. Plateau means blood serum concentration is reached and maintained. Okay. When you give a medication to your patient, it is very important that the therapeutic level of the medication is within this range. It should be maintained so that the patients will experience relief or therapeutic effect of the medication. And normally, we should always maintain therapeutic range, therapeutic level of the medication. That's why medication is normally given routinely every 2 hours, every 3 hours, every 6 hours. Why? Because we want to maintain the therapeutic range. We want to maintain the plateau. Okay, we have to reach it. Now, duration is very important. It is a time medication takes to produce response. Okay? And you would see in this photo the duration of time response. Once the duration is reached, okay, the effect will eventually go down and the patient will start to experience the symptoms again. That's why it's very important that if your patient is receiving medication, if the instruction is to give the medication routinely every 6 hours, every 8 hours, every 12 hours, it is very important to follow that. Why? Because medications have desired duration and we want to maintain therapeutic range. That is why we need to give regularly the medication to our patient. Through is a time at which the drug is at its lowest amount in the serum. That means the medication in our blood is reduced and maybe the patients will develop again the different symptoms. Okay, these are the actions of drugs in the body. Okay, when giving medication, it's also very important for a nurse to understand, okay, the process or phases of the actions of the medications into our body. Okay, from the moment it is taken and until the moment it is excreted out of the body. And the term that we use here is called pharmacokinetics, or it is the study of the absorption, distribution, metabolism, and excretion of the drug. The first phase or the first step of the process in pharmacokinetics is absorption, or how well it gets in. Most medications are given through the mouth. Of course, there are also medications which are given or injected directly to the bloodstream, but most medications are given through the mouth. And normally, absorption takes place mainly in the stomach and small intestine. Okay? And absorption process of the medication is mainly affected, okay, by the gastric content. That means if the patient eat a lot of food, it might alter the absorption of the medication. That's why some medications are taken before and after eating. Okay. It is also affected by the level of acidity of the stomach. If the stomach has high level of acidity, it might affect also the absorption of the medication. Now, once the medication is absorbed in the stomach and small intestine, it will be transported or it will be absorbed into the bloodstream and it will be distributed to the other organs of the body. Again, once the medication is absorbed in the stomach and small intestine, it will be absorbed into the bloodstream and it will be distributed into the different major organs of the body. Okay, mainly through the liver, the kidneys, and the brains, and it is where it takes its effect. Now, normally, medication has to be converted to a less active form. And our liver is very important in the process of metabolism. It has to be broken down. It has to be broken down so that it can easily be excreted out of our body. We call it as metabolism. In some other books, we call it as biotransformation or detoxification. The medication will be detoxified. It will be converted into a less active form, mainly through the liver. This is how important your liver is to metabolize medication. Once this medication is metabolized, it is converted into a less active form. It is now easy for the body to excrete this medication. So the last process or stage in pharmacokinetics is excretion. How does it leave the body? Most medications are normally eliminated through our kidneys in a form of urine. However, there are some medications also that are excreted through our feces, breath, and perspiration. So that means if you have problem with the kidneys, you might have a problem with the excretion of these medications. Okay, that's why it is very important when you give the medication, you need to check what are the existing problems of the patient. Does the patient have a problem with the stomach? Because it might affect absorption. Or does the patient has a problem with blood circulation? Why? Because it might affect distribution. Or does the patient has a problem with the liver? Why? Because metabolism might be affected. Or does the patient has a problem with kidneys? Why? Because excretion takes place in the kidney. Those are the things that you need to remember in pharmacokinetics. So what are the factors that affects medication action? As a nurse, it is very important for you to know and identify these factors, okay, because it has some effects to your patient. One is developmental factors, and when we say developmental factors, we're talking about the age of your patient. Okay, how does it affect medication action? Normally, infants or children, they usually requires small dosages because some of their body systems are not yet mature, okay, such as the liver, such as the stomach, okay. And if you have a patient who is an adult, normally, if your patient is adult, the dose is higher than the infant. Or if your patient is elderly, older adult, okay, baba. And normally, if your patient is older adult, they also have some physiological problems because of their age, their stomach's absorption is already affected, or maybe they have problems with circulations that would affect, the distribution of absorption of the medication. Or if your patient is pregnant. If the patient is pregnant, you cannot just give any medication to your patient. Why? Because it might have some effect to the baby or to the fetus. The next factor is sex or gender. Being female, being male, affects medication action. And normally it has something to do with the body fat and hormonal differences. Why? Because most female patients have more body fat percentage in the body. And remember, body fats also alters absorption of the medication. If the patient is obese, the absorption of the medication on the skin is reduced because of the body fat. And also hormones. Hormones affect the absorption of medication. Now, the third factor is cultural, ethnic, and genetic factors. There are some ethnicity or there are some genes wherein the response of medication is different from other ethnicity. There are some group of people wherein when you give a medication, immediately the patient will respond. However, when you give similar dosage to another patients from other culture or other ethnicity, it might have a different effect. Okay. Also cultural factors. Some cultures, especially Chinese, they are fond of taking herbal medications. Herbal medication, this comes from traditional way of, treating or curing diseases, usually from herbs, from plants, or from any other forms. And if your patient is taking this herbal remedy or herbal medications, it has some effect on the medication. It might slow down or it might speed up the action. Okay, now, how does diet affects medication? There are some nutrients, there are some food that affects the absorption of some other medication. One good example of diet or food that has an effect to a patient is vegetables. Vegetables. Vegetable is high in vitamin K. Okay. And if your patient is taking this medication called warfarin or Coumadin, okay, and your patient is taking a lot of vegetables, normally there would be an opposing action between the diet of your patient. That means the medication being taken by your patient will not fully take its effect because of the diet the patient is eating or taking. Environment is a big factor. Why? For example, if the temperature is very high, very hot, very warm, normally what will happen to the blood flow of your patient? Normally the blood vessels are dilated, okay? And if the blood vessels are dilated, there are some medications wherein its actions are increased, okay, such as vasodilators. Or if the environment is very cold, okay, there are some medications also wherein the effect will be speed up if the environment is very cold. Why? If the environment is very cold, it causes vasoconstriction. And if your patient is taking this medication called vasoconstrictors to constrict the blood vessels and the temperature is very cold, okay, the purpose, the action of these vasoconstrictors will be speed up. Okay. And of course, if the environment is noisy, there's a lot of noise, and your patient is taking sedatives to improve sleep. Even if your patient is taking sedatives, but the environment is very noisy, the patient cannot sleep. Okay. Now, we also have psychological factors. This is very important, especially if your patient is taking medication. Psychological factors is your client's expectation that the medication will take its effect. And this is common if your patient is taking pain reliever. I'll give you an example. If your patient has pain and you give a pain reliever to your patient, if your patients believe that this pain reliever is effective, this Panadol is effective, this Panadol is effective, and then because of his expectation, the patient will experience pain relief right away. However, there are some patients who do not believe in the action of medication. If you give Panadol to your patient, but your patient doesn't believe in its effect, no matter how high you give this Panadol to your patient, because your patient doesn't believe in the action of this medication, your patient doesn't expect this medication to take its effect, your patient will not experience pain relief. That is how important your psychological factors is. That's why when you take medication, you need to believe that the medication will treat or cure your diseases or illnesses. Time of administration is very important. Okay. And it has something to do with the speed by which the medications will act. If the medication is taken by mouth, it takes time before the patient will experience relief. Why? Because it has to be absorbed by the stomach. It has to be absorbed by small intestine. However, if your medication is given through the bloodstream, through injection, okay, normally it will take its effect rapidly. Another example, there are some medications which should be given before meal or after meal. This is very important. Why? Because the absorption of the medication depends on the amount of food that you have in your stomach. Okay, that's why there are some medications which are given on a specific time. Why? Because the timing itself of giving medication affects the medication action. Now, what are the different routes? Routes means where do you give the medication? Where do you administer the medication? The most common route of giving medication is through oral route, through the mouth. This is the most convenient. Convenient why? We just give the medication to the patient. It is least expensive. Okay, it doesn't require budget. It doesn't require money. Okay. However, the problem with oral route administration of medication is that some of the drugs has unpleasant taste. That's why most children dislike medications, okay, because of the taste. What else? Some of these medications can actually irritate your stomach. That's why when you take a medication, in most cases you have to eat. Or another one is that there are some patients, especially those who have nausea and vomiting, wherein oral route could not be possible. Another important route of administration is sublingual route. From the word itself, sublingual means under the patient's tongue. You can also give medications through that route. Why? Because under the tongue, we have a lot of blood vessels. And the medications will be absorbed into these blood vessels and it will be distributed to the other parts of the body. Okay, these are more potent than oral route. Means more effective. The effect is rapid than the oral mouth. However, the problem with sublingual route is that sometimes patient might swallow the medication. And this medication, if it's swallowed, the gastric juice, the acid, hydrochloric acid in our stomach, will inactivate this medication. That's why, if your patient is taking sublingual route, you need to instruct your patient to open the mouth, put the medication under the tongue, and never swallow the medication. Okay, some medications through sublingual route can also cause stinging or irritation of the membrane. Stinging means there are some slight pain sensation or discomfort in the mouth or some irritation. Now, this is another form or routes of administrations through parental route. Parental means through the bloodstream through injection, through subcutaneous through the fats, intramuscular through the muscles, intradermal through the skin, intravenous through the blood vessels itself. And this route of administration of medication provides the fastest absorption. Why fastest? Because no need for absorption. It is already in the blood vessels and it is ready to be distributed to the other parts of the body. The problem with parenteral route is that, of course, if you receive injection, there would be breaks in skin barrier. Okay? Because of the needle. Some patients might experience irritation of the skin. After injection, the patient might develop irritation. Some patients might develop pain. And most importantly, this is expensive. Medications through injections are quite expensive than those medications given through oral route. Now, aside from the different routes, we also have topical routes. From the word itself, topical means superficial surface of the skin. Like for example, Dermaprep, those medications applied to the skin. Instillations and irrigations. Okay? We also have medications through given inhalations. You will learn all these things in the next few sessions. These are topical route medications. Most of these medications given through topical route has few side effects. Why? There's no GI problem. Why? Because this medication doesn't pass stomach and small intestine. That's why few side effects and the GI problem is less. However, one of the most common concern if your patient is taking topical route is that it leaves residue on the skin. If your patient has a derma preparation, lotion, cream, it would have skin residue. What else? If your patient has a wound in the skin and you apply a medication through topical route, what will happen to the medication? It will be absorbed into your wound, into the abrasion, and it might cause systemic effect. Systemic effect means the entire body system is included. Okay, these are the different routes of medication administration. As I have mentioned in my first few slides, when your patient is receiving medication, it requires prescription from a doctor. It requires an order from the doctor. That means you cannot just give medication to your patient without the order, without the medication order. And medication order normally comes from physician or doctors. If your patient has a medication order, it is very important for you to understand what is the content of this order, what it says, the different parts. Like for example, you need to take note of the date and time. This is very important. Okay? The client's full name. The name of the drug should be there. You need to check for that. The dosage. How many milligrams is required for the patient? The route. Okay. How to give this one? Through the mouth, through the skin, through injection. Time and frequency is very important. How frequent are you going to give it to the patient? Every 1 hour, every 2 hours, every 3 hours? Those things. And most importantly, the signature of person ordering. Okay, you need to ask for the signature of the doctor. You cannot give the medication. You cannot carry out this order if the medication order is missing some other parts. Again, the medication order, this is required before you give the medication to your patient to make sure that the medication is prescribed by the doctor. Only prescribed medication shall be given to your patient. If it is not prescribed by doctor, you should not give it to your patient. Okay, once you receive a medication prescription from your patient, when you receive the medication order from your patient, one of the things that you need to check is the order itself. The order means when do you have to give this medication or until when you're going to give this medication. Now, there are 4 types of medication orders. The first one is stop order drug to be given immediately at once. For example, Lipitor 10 mg. If the order is stop, that means you need to give the Lipitor right away to your patient, immediately to the patient. Stop order. You might also see some order like single order or one-time order. to be given at specified time. For example, Lipitor 10 milligram at bedtime. You need to give this medication to your patient once only in a specific time. For example, in the morning. Or you can give this medication in the evening. Or you can give this medication in the afternoon. After you give the medication, kalas. You also have standing order. Okay, standing order of drug that is carried out indefinitely until an order to cancel is made. For example, Lipitor 10 milligram 1 tab every day, which means you need to give this medication to your patients every day. When do you stop giving this medication? Until the doctor would say the medication is cancelled. Otherwise, it should be given every day. We call it a standing order. We also have PRN order or as needed order. Drugs are given when in the nurse's judgment the patient requires it. For example, Lipitor 10 milligram PRN. PRN means as needed. Now, what is nurse's judgment? If your patient, for example, is taking paracetamol, PRN for fever, if based on your assessment the patient has a fever, you give this medication. If based on your judgment the patient doesn't require paracetamol, you never give this one. Again, PRN if needed. Or there are some medications, for example, that is only given if the patient's blood pressure is high. PRN order, which means based on your judgment, based on your assessment, the patient blood pressure is high, so you need to give the antihypertensive drug based on your nurse's judgment, you give it. But if you think the patient doesn't need this one, you never give. Again, this is PRN. Only if it is needed. And it is based on your judgment. Okay? These are the different orders of medications. Giving medication requires knowledge of nurses on drug calculations. Remember, some drugs or medication orders requires calculations or computation before you can give it to your patient. Especially if you are giving injections, especially if you are giving liquid medications, you need to calculate before you prepare the medications and give it to your patient. And this is the standard formula that we use when we calculate medication. Describe desired amount or prescribed amount divided by available dose multiplied by quantity. Okay? And I'm going to discuss this one in my next few slides. Another important thing that nurses should remember when giving medication is that there are some medications that needs to be converted into other metrics or other measurements. Okay? Because some medications are in the metric form and you need to convert it in household form or you need to convert it in apothecary. For example, if the order is in milliliter or ml, however, you need to give it in teaspoon, you need to give it in drops, you need to give it on tablespoon. So how do you do that? There are calculations. There are conversions that you need to follow. Now, as a nurse, I want you to be familiar with these slides. I want you to be familiar with the conversion from metric to apothecary, from metric to household. I'll give you an example. Okay, the order is morphine 1/4 grain. The order here or the instruction is convert the ordered dose to milligram. Now, how do you convert grains to milligrams? Of course, you just need to look at the table. You know that 1/4 grain is 15 milligram. Okay, another example. The order is Panadol 1 tablespoon. Okay, 1 tablespoon. And the instruction is to convert the order dose to ml. Again, you need to look at the table. 1 tablespoon is how many ml? It is normally 15 ml. Okay? I want you to remember this one. This is very important, especially if you are working as a nurse. And these are other dosage calculations conversion also. Again, take note of this because later on, when you calculate some medication, before you can get the right amount, you need to convert it first. I'm going to give you examples on my next few slides. Okay, now, as I mentioned earlier, Medication administration is an invasive procedure. Invasive because the moment you give the medication to the patient and the moment the patients develop harmful, toxic, or adverse effects, it is difficult to reverse the action of the medication. And if you committed those errors or mistakes when giving medications, you might end up causing injury to your patient or you might end up killing your patient. So how are we going to protect ourselves from causing errors or harms to our patients? The good thing is there are 10 rights, okay, of medication administration, which if we're going to follow this one religiously, we can avoid medication error and harm to our patients. Okay, and what are these rights to medication administration? I'm going to discuss one by one. We have right patient, right medication, right time, right dose, right route, right assessment, right to refuse, right education, right evaluation, and right documentation. I'm going to discuss each and every rights, and I'm going to discuss how do you follow these rights in order to reduce medication error or harm to your patient. Okay, the first right to medication administration is right patient. Okay, it says there, you can avoid errors or medication errors to your patient if you are able to identify or give the medication to a right patient. Again, medication should be given to a right patient. So how do you ensure that you are giving the right medication to a right patient? First is you need to check the order of the doctor. Check the patient's chart. To which patient you are supposed to give the medication. And when you are giving the medication to the patients in the bed, before you give the medication, you identify the patients correctly. You ask the name of the patient, you check the ID badge, and you verify what's in the ID badge. And normally, there are two identifiers that we use. First is the complete name of the patient, Muhammad Ali. And the second identifier is the MRN number or the medical record number. Okay, 1, 2, 3, 4, 5 or whatsoever. If you are able to follow or check these things, you are sure that you are giving the right medication to a right patient. The second right to medication administration is right medication. Okay, and this is one of the most common errors nurses do when giving medication. They are giving a wrong drug or medication to their patient. So how do you ensure that you are giving the right medication to your patient? Of course, you need to check the medication label. Is it Demerol? Is it Panadol? Is it insulin that I'm going to give to your patient? Check the medication level. Especially, you need to check for the trade's name and you need to check for the generic name. Because some medications looks the same and sounds the same. That's why you need to check trade's name and generic name. And most importantly, check the physician's order. What is the order of the doctor? Is it Panadol? Is it Demerol? Is it insulin? You need to verify. You need to check, okay, the doctor's order. Now, if you can check the medication level correctly, and you are able to check the physician's order correctly, you're sure that you're giving the right medication to your patient. The next right to medication administration is right time. Okay, so you have the right patient, the medication that you have prepared is correct. So at this time, you need to follow the right time. Okay. One of the most common error among nurses is that they give the medication in a wrong time. Wrong time. Remember, as I mentioned earlier, timing of medication is very important to make sure that the therapeutic level of this medication is maintained in our blood. How do you ensure right time in medication administration? First is confirm when was the last time the medication was given. Again, medications are given in the right timing. If you are able or if you give the medication in a wrong time, for example, the order is every 4 hours. However, you're able to give the medication after 10 hours. or after an hour. What will happen? It could either be that the medication will cause problem to the patient or the medication will not take its effect. Again, check the last dose, when it was given, last week. The second one is check the frequency of the ordered medication. Okay, as I mentioned earlier, medications are given in the right timing. Some medications are given once, some medications are given twice a day, some medications are given 3 times a day, and etc. Timing is very important, and make sure you know how frequent you are giving the medication to your patient. And in doing so, you need to be familiar with the different abbreviations in the hospital. Most hospitals will not say Panadol 3 times a day. They will not do that. Instead, they use abbreviations. They will say Panadol Stat or Panadol BID or Panadol TID. So that means you need to know what does these abbreviations mean. And on the slide right now are the common abbreviations that we use, okay, when we are giving medication. As mentioned earlier, Stat, the medication says Stat means you give it immediately to your patient. If the medication says BID, that means the medication should be given twice a day. TID, the medication should be given 3 times a day. QID, 4 times a day. QH, which means the medication should be given every hour. Q4H, that means the medication should be given every 4 hours. When you go to certain hospitals, they have other abbreviations that you will learn. But these are the basic abbreviations that you need to learn in order for you to be able to follow the right time to medication administration. The next right to medication administration is right dose. Your patient is correct. You have prepared the correct medication. And you know when to give this medication. But the problem is now, you do not know how much medication do you give to your patient. And I am referring to dose. Dose means the amount or weight of the medication. And for you to be able to correctly give the right dose to your patient, you should be knowledgeable about the formula when giving medication. That means you need to know how to calculate. You need to know how to apply this formula. How can you make sure that you are giving the right dose? First is you need to check the order. Remember, the order of the doctor contains how much dose you're supposed to give to your patient. Is it 500 milligram, 250 ml, or 1,000 grams, etc.? You need to check for the doctor's order. Number 2, validate drug dose using the drug reference. Drug reference is a small book that contains the lists of the medications and the normal dosages. Now, why do you need to validate drug dose? Sometimes you will be given an order that might confuse you. For example, the order of the medication is very high for an infant or a toddler, and you feel that the drug dose is wrong. Or the order of the doctor is very small because your patient is adult. Now, if you are confused, if you are not sure if this is the desired dose for a certain age, you need to validate the drug dose. You need to check. Okay? It is very important that you need to check. And you can actually go back to the doctor. You can ask the doctor, Doctor, our patient is 1 year old and your order is big enough for the patient, or your order is small enough for the patient. You can actually do that. And the third thing is for you to be able to calculate the dose. As I mentioned earlier, the doctor will order the medication, but in most instances, you need to determine how much medication you're going to give to your patient. How many ml, how many tablets, how many capsules. You can only do that if you know how to calculate the medication. And this is the standard formula that we use when we calculate medication. This is standard whether your medication is oral, liquid, or injection. This is the same formula that we use. First is the desired amount. Desired amount means what is the order of the doctor? What is the instruction of the doctor? To give 150 milligram, to give 2 tablets, to give 3 tablets. This is the desired amount. How much or how many medications or how many ml the doctor wants you to give to your patient. divided by available dose. Available dose, what is the available medication that you have in your area? Is it 500 milligram only is the available? Is it 1000 milligram that is available? You need to check what is the available with you. And then you multiply it by quantity. And it will give you the right amount of medication to be given to your patient. Now, using the formula that I have presented to you in the previous slides, I want you to calculate the dose. The order of the doctor might look like this. Okay? If you need to give 500 milligrams of a drug, which comes as 250 milligrams tablet, how many tablets will you need to give to the patient? Remember, our formula is desired over available multiplied by quantity. So how many tablets are you going to give to your patient? Applying the formula, what is the desired? What is the order of the doctor? How many milligrams are you supposed to give to the patient? The doctor says 500 milligrams. Give 500. Okay, that is 500 divided by what's the available. What is the stock? What is the available in the ward? And it says there that the available tablets in your area is only 250 milligrams per tablet. So if the order is 500 milligram and the available medications that you have is 250 milligram, so how many tablets do you give to your patient? So the formula, 500 divided by 250 multiplied by 1, and it will give you 2 tablets. So you need to give patients 2 tablets. Okay, we have another example. Okay, calculate the dose. If the doctor prescribe, or if your doctor prescribe 0.5 ml of ibuprofen, which comes as ibuprofen 500 milligrams per teaspoon, how many milligrams you need to give the patient? Okay, in this example, you need to convert. Remember, teaspoon is another matrix, and ml is another matrix, and you can only compute or calculate the dose if you convert either ml or teaspoon. Okay, so how do we calculate for the dose? Okay, remember in this example, you need to convert teaspoon and ml for you to be able to calculate the right milligrams. Okay, you can do this by converting teaspoon to ml. And we all know that 1 teaspoon is equal to 5 ml. So when we apply the formula, it would be 0.5 because the order of the doctor is to give 0.5 ml divided by the available. What is the available dose? What is the available medications that you have? Teaspoon. Okay? It says there 500 milligrams per teaspoon. Okay. But the order is ml and the available is teaspoon. That's why you need to convert teaspoon to ml. That's why you need to divide 0.5 divided by 5 and multiply by quantity, which is 500 milligram. And it will give you an answer of 50 milligram. Another rights to medication administration is right route. Perhaps the patient is correct. You are able to identify the medication correctly. You know when to give the medication. And also you know how much medications to be given to the patients because you have applied the formula. But the right route is very important. Remember, there are several routes. There are several ways on how you can give the medication to the patient. It could either through the mouth, through the skin, through the bloodstream. Okay, it could be inhalation, it could be a patch, or it could be under the tongue. There are different ways, and you need to learn what is the appropriate route of the medication ordered by the doctor. Okay, why? Because there are medications, when given in a wrong route, usually the effect is different or the effect is toxic to the patient. Okay? And the effect is not effective as it is supposed to be. So how do you make sure that you are giving the right medication in a right route? One, check the order and appropriateness of the route order. Remember in the prescription, remember in the medication order by the doctor, it is written there. How do you give the medications to the patient? Mouth, skin, blood vessels, through injection, etc. And number two, confirm that the patients can take or receive the medication by the ordered route. For example, the order of the doctor is to give the medication through the mouth. However, when you check the patient cannot swallow. The patient has a problem with the mouth. You need to check, okay, if the patient is capable of receiving those things. That is right route. You also have right assessment. This is very, very important. Before you give the medication to the patient, you need to do assessment. Okay? Properly assess patient and tests to determine if medication is safe and appropriate. If deemed unsafe or inappropriate, notify ordering physician and document notification. Okay? Now, how do you assess the patient and why is this important? For example, if your patient is taking Panadol as pain reliever, what do you think is the most important assessment that you need to do before giving the pain reliever? Of course, pain assessment. Or if your patient is taking Panadol because the patient has a fever, what do you think is the important assessment? Of course, you assess for the body temperature. Okay? Those are examples of assessment. However, in the next slide, I'm going to discuss other assessment that you need to do or perform to your patient prior to giving the medication. As previously mentioned, when you give medication, you do certain assessment, and this is applicable for all medications. Why? Most common errors of nurses is that they give the medication without assessing the patient, only to find out that the patient has certain conditions that would worsen the condition of the patient. So what are the things that you need to check? What are the things that you need to perform to your patient prior to giving medication? First is allergies to medication. Okay, allergies to medication is very important because medication is a foreign body. And most patients, especially for those who are receiving for the first time, develops allergy. So how do you do that? Ask your patient, ma'am, do you have any allergies or any medications? You need to ask your patient. Number two, ability to swallow. Especially if you are giving oral medication, tablet, capsule, or syrup, or suspension. Before you give those medication, you need to check if the patient can swallow. So how do you do that? You can either ask your patient if she has a problem with swallowing. Or if you can see that your patient is eating or drinking, that means there's no problem with swallowing. Never give medication to your patient if the patient has a problem with swallowing. 3. Assess if patient is on NPO, nauseated or vomited, or has NGT. NPO means nothing per organ. There are some patients in the hospital wherein food and fluid are prohibited for a certain period. Okay? Maybe the patient is for certain tests, or maybe the patient is for surgery. NPO order is there. When you see in the patient's chart that the patient has NPO order, never give food or fluid or medication to your patient. Nausea and vomiting, you know already, nausea and vomiting. Why? It's useless. If the patient is vomiting and you give a medication, it will just be vomited. It's useless. NGT, it's a tube inserted into the nostrils directly into the stomach. If the patient has a tube into the stomach, you never give the medication through the mouth. What you will do, usually the medication is given through NGT also. In most cases, it is added to the food. In most cases, you need to grind and powderize, and through the tube, give it to the patient. Fourth assessment is assess client's knowledge about medication. client's knowledge about medication. So how do you do this? You ask your patients, okay, Mister, I'm going to give you Panadol. Do you have any idea what is Panadol? Do you know the purpose of this medication? If the patient doesn't know the medication at all, never give the medication. You need to educate your patient. This is Panadol, this is Demerol, and the purpose of this medication is this. You need to explain to your patient if your patient doesn't have the knowledge. And number 5, perform assessment is specific to medication. Now, medications have their specific assessment. Just like what I gave an example earlier. If the medication is for fever, the most important assessment is temperature. If the medication is insulin, you know already that insulin is for blood sugar. So what would be your assessment? You check for the blood sugar. If the medication is for hypertension, what is your assessment? You check for the blood pressure. If the medication is it has an effect on the pulse rate, okay? We have medications like that. Your assessment would be on checking for the pulse rate before you give the medication. This is very important if your patient is receiving medication. Okay, another rights to administration of medication is education. Okay, and how do you follow or adhere to this right of education? Inform the patient of medication being administered. Always tell your patients what's the purpose of the medication. Always educate your patient why the medication is given. Okay? Or you can also tell your patient what is the desired of this medication. You can also tell your patient what are the possible side effects of these medications. So how do you do this? For example, you're giving insulin to your patient and you know that insulin is for blood sugar. So how do you tell the purpose? You will say, Mister, I'm going to give you insulin. This insulin is given in order to stabilize your blood sugar level. Okay, that's the purpose. And the desired effect, your blood sugar will be stabilized and it will become normal. You need to tell also the side effects. Okay, Mister, this insulin, it has some side effects. It might lower down your blood sugar level. That's why you need to have a food at the bedside. Tell the patients what are the possible side effects. And of course, you need to ask your patients for any allergies. Okay, these rights to education, to medication administration should be done, okay, when giving medication to your patient. The next rights to medication administration is right to refuse. Patient has the right to refuse. If the patient doesn't want to take the medication, we cannot force our patient. We cannot force the medication if the patient doesn't want to take the medication. Why? Because any patient has a right to refuse. Okay, while the patient has the right to refuse of any medication, it is very important on our part as nurses to tell or inform the patient what are the consequences of refusing the medication. For example, if the patient refuses for insulin injection, nurse, I don't want that insulin injection. You cannot force the patient, but explain to the patient the consequence. Okay, Mister, this insulin, this is very important. If I will not give this insulin to you, your blood sugar level will increase. Or if you're not going to take this antihypertensive drug, your blood pressure will increase. Or if you're not going to take this Panadol, your fever will not be treated. It will not lower down. You need to tell the consequences. This is very, very important. 3, notify the physician that ordered medication and document notification. And number 4, document refusal of medication and that party responsible understand consequences. If the patient refuses to receive the medication or to take the medication, even if you have explained already, you have already explained the possible consequences to the patient and yet still the patient refuses, you cannot force the patient, but make sure to document that your patient refused. Why? Because if something happens to your patient and it is not properly documented that your patient refuses, okay, you might be blamed. of whatever happens to your patient. You need to document the patient refused to take the medication, etc., etc. It should be documented. It should be written in the patient's chart. Yes, the patients can refuse, but make sure to explain the consequences. And if ever the patient will not still take the medication, document the refusal of the medication. Okay, the ninth right to medication administration is right documentation. We have a saying in nursing that if it is not charted, if it is not documented, then it is not done. If you are giving medications to your patient, you should have evidence with you. And your evidence is your documentation. Okay, when we say documentation, is that you document that you have given the medication in a specific time, but you only do the documentation only after you give the medication. Never document that you give the medication before giving the medication to the patient. Documentation should be after giving the medication. And normally what we write in the documentation is the time, which time we give the medication, the route, and other specific information. On the next slide, I'm going to show you the documentation for medication that we follow when we are giving medication to our patient. And the last rights to medication administration is right evaluation. When you give the medication, make sure to evaluate at the end or after some time if the medications that you have taken is effective or not, or if the patients develop side effects or not. So what are you going to evaluate? First, assess for patients for any adverse side effects. After giving the medications, you need to go back to your patient. You need to check your patient. Check maybe the patient is having adverse side effects. Check maybe the patient is having allergic reaction. Number 2, assess patient for effectiveness of medication. How do you know if the medication is effective or not? After giving the medication, you go back to the patient after few hours or few minutes. For example, you give Panadol. And then after 30 to 1 hour, you go back to the patient. And what will you do? You are going to check again the temperature. You're going to check again the pain. Because by doing that, you can identify if the medication is effective or not. And number 3, compare patient's prior status with post-medication status. What do we mean by this? Okay, try to compare what is the situation of your patients before you give the medication and after you give the medication. Are there changes? Did the vital signs change after you give the medication? Did the patient's condition deteriorate after you give the medication? Or no changes? Okay, you need to check for that. And number 4, this is very important, especially if your patients develop adverse reaction. If your patients develop untoward reaction, you need to document the patient response in the patient's chart. Okay, this is an example of the MAR. We call it as MAR or Medication Administration Record that we use in the hospital. So when there's an order of the medication, okay, and you want to check what are the medications to be given to your patients, you just need to check the MAR or Medication Administration Record. So this MAR, the patient is Muhammad Ali, MRN is 123456, and you will see the scheduled medication. The patient has 2 medications here. Panadol, tablet, 250 mg, okay? Route oral, schedule 3 times a day, quantity to be administered to 50 mg, processing notes. It will show you what you're going to do and assess. And you will see the last 3 columns, these are timings. It is divided into 3. Why? Because the nurse has 3 shifts. Morning, okay, evening, and night. That means if you are in the morning and you give the medication to your patient in the morning, you need to affix your name or initial in the column for morning. If you work in evening, of course you need to locate the column for evening and you need to affix your initial. If you work on night, of course you need to look for the last column, and when you give the medication, you need to write your initial on such column. Okay? Here's another example of the medication order. In this example, the medication is liquid ibuprofen syrup, 250 milligram per 5 ml, and the order to be given is 125 milligram through oral route. Again, the processing note says assess pain. And on the last 3 columns, you will see the timing. This is very important. And when you go to the lab, we're going to practice how to give medication. And after medication, administration, you're going to document using this form. Lastly, what are the developmental considerations? Okay, what are you going to monitor? What are you going to consider when giving medication, especially considering the age and the development of your patient? Okay, normally, oral medications for children are prepared in sweetened liquid forms. As mentioned earlier, you would notice children's, their medication syrup, it is flavored like fruits or gums. Why? Children dislikes medication and they will not take it if the taste of the medication is not desirable. Okay, this is very important also. Do not use foods such as milk and juice to mask the taste. As mentioned earlier, some medications has a undesirable taste, but never mix it with milk and juice. Okay, it is not allowed because it might alter the function or the effectivity of the medication. Another thing, if you are giving injection to a child, okay, acknowledge that the child will feel pain. Children feel pain also just like adults. And if the patient is, crying or the patient is afraid of the injection, you need to explain well to the patient, you need to assure the patient, and it is very important that you acknowledge it. Another developmental consideration, when you are giving medication to older adults, always remember that adults have several physiological problems. There are some bodily functions are declined if you are getting old. And these physiological changes might, affect, some processes or medication actions or processes in the body. For example, altered memory. Okay, what else? Decreased visual acuity. There are some medications that would affect visual acuity. And remember, your patients will already have a problem with this. Okay? Or the patients might not be able to accurately take the right amount or number of medication because the patient's visual acuity is a problem. Decrease in renal or liver function. Remember, liver is important for drug metabolism. Remember, renal or kidneys are important for excretion of medication. That's why, if your patient is older adults, you need to be very careful when giving this medication because they are prone to liver and renal problems. Slower absorption from the GI tract. Remember, in our earlier discussion, medications, especially oral medications, are absorbed mainly in the GI tract. And because the patient might have some issues in the stomach, the absorption is very low, you might expect that there is also an effect for that, for the medication absorption. Increased fat proportion in the body. As mentioned earlier, the rapid distribution and absorption of the medication is also affected by the fat composition of the patient. If you are injecting a medication to an obese patient, you expect that the medication will take its effect a little slower. Why? Because the fat doesn't have blood vessels. The medications will have very low absorption because there's no blood vessels. Decreased manual dexterity. Manual dexterity means the patient might be shaking, and if the patient is receiving some injection, they are prone to injury or any issues. So these are the different developmental considerations that you need to remember. Okay, that is the first part of our medication. On our next session, we're going to focus on administration of medication through parenteral route of medication administration, and Ms. Jancy will discuss all those things. Okay, I want you to get ready with the flip classroom on Wednesday. After your quiz, we still have 40 minutes. We're going to have a flip classroom. I'm going to post some pictures, I'm going to post some questions, and I will be calling each student to answer or to react to my post so that we will have a very rich discussion about our topic on medication. Thank you so much.